Welcome to episode 4 of the Student Physio podcast. My name's Damien. It's quite an exciting podcast today. I'm going to keep this intro short and sweet because we want to get into the discussion. Most of us have just finished our placements, first year 1 placements, and according to some people who've given me some feedback and I've talked to, they've been really exciting, really interesting. So I've got 3 people to talk to, Sophie, Thusha and Senorina, who are going to give us their perspective of what their placements were like. And I'm going to chip in a couple of times as well. And we're going to discuss how we got on, what was exciting about it, what we found challenging, all that kind of stuff. I really hope you enjoy it. And now that we've got ourselves a little bit established and we've got some people listening to the podcast, I really would appreciate if you could share and like and share with your social medias, so that we can just increase the reach a little bit. There's a whole new cohort of people who are going to be starting at King's and also other universities in September, and I'd love to engage with them as well, and really find out what it is that they want to hear from future podcasts. So if you are listening to this for the first time and you'd like to get involved, please drop me a line. I've recently set up an Instagram page for this podcast. It's Student Physio Podcast with underlines, and you can find that very simply. Engage me through there, or you can engage me through my kcl.ac email address, so damien.taylor@kcl.ac.uk. And I'm very happy to take any feedback or answer any questions. Failing that, if you're connected to me on WhatsApp, feel free to contact me via that either as well. I'm very happy to do that. Just before I go, we get into it with the gang. The step after this would be when our next interview is going to be with Damien, who's the new president of the Physio Society. So Damien is going to be interviewing Damien. I'm sure I'll make that joke a few times, and looking forward to that. We did interview with Adam last month. Beg your pardon, it was in July, and that was really good, really interesting to kind of hear his story. I don't know Damien at all, never spoken to him apart from a couple of messages just to say that, ask him to come on board, which he agreed to, and really looking forward to talking to him and finding out more about his journey from into a physio degree. So let's get into the discussion, and I hope you'll enjoy it. Welcome to the team, who are going to talk about our placements today, and we're going to be basically doing a debrief. So the team are going to talk about their experiences and what they went through while they were on their placement. So welcome, team. Hello.
Hello.
What we're going to do is we're just going to introduce ourselves. So we'll start with who we are, why we chose physiotherapy as a course, and then once we've done that, we'll then come back around and we'll talk about our placements and what our experiences were, if that's all right. So Sophie, can I start with you?
Yeah.
Who are you?
I'm Sophie. I chose physio because I've always been quite sporty growing up, quite competitive in like different sports, and I was the sibling that was always ending up in A&E and injured and had to recover. So I thought medicine was too different to what I wanted. It was very short contact with patients, and I knew that the journey of being a patient myself, going through physio and see family go through physio, it's quite cool to see the whole progression, and that's kind of what I wanted to do, and it kind of ties in with sport and NHS and the army, so it's just the perfect bundle for me. So that's me.
The army? What's the army connection?
Some family have served, so I just thought it'd be quite good fun, and I knew I could never do a desk job and sit behind a desk for like 9 hours a day, and I'd rather do something active. So that's pretty much it. Yeah, just fly around the world saving people and doing that stuff.
Cool. So what's your plan for doing that?
I haven't got a plan just yet. I've got loads of plans working. We're going to see what happens.
Okay, good stuff. Senorina, why don't you introduce yourself?
Yeah, sure. So I'm Senorina. I'm also a physio, same as the other three in the call. So my reason for choosing to study physio is kind of a last minute thing, to be honest, because I always know I want to get into healthcare, but I was kind of debating whether I should go into nursing or physio instead. But as just the same as Sophie, I'm also an athletic person. My whole family does sports, but then my family isn't exactly very healthy in terms of um like health wise, because a lot of my family members often get sick, injured, but then there's nobody in the family or among our relatives who is a medical professional, and I hope to be the first one to become at least a healthcare professional. And that's why I decided to choose physio, because apart from having the passion to study healthcare related subjects, I also like to do hands-on stuff more. So I
Yeah.
figured out physio is the perfect career for me.
Wow.
Yeah.
And you're from China, yes?
I'm from Hong Kong, actually.
From Hong Kong. Beg your pardon. I beg your pardon. And how's it been studying first year in the UK?
It's kind of a big step for me, because to move all the way across the globe to a foreign country is definitely a first time for me. Especially I haven't studied abroad for high school, and it's my first time leaving home for such a long while to study in a new country. But I adapt very quickly, and pretty much within the first month here, I've already got used to everything. So
Wow.
it's not really much of a problem, to be honest. But then sometimes there are a little bumps here and there, but everything gets solved really quickly. So it's not that much of an issue.
Fantastic. That's brilliant. Okay, I'm glad that it's not being a massive issue for you settling in. I wouldn't be able to study in a different country. I think I'd struggle with that. So well done you, Fisher.
So, yeah, my name's Tushar. Why I chose physio? Well, my dad is a physio, and I guess I've always like learned what he does in his job, and I quite enjoyed what he does. And like similar to the other two, I'm pretty much sporty as well. I do a lot of badminton on the side, and yeah, I've injured a lot of parts of my body, and my dad would always like do the rehab and everything, and I found that really cool. So pretty much just wanted to do a bit of that really.
Yeah. What type of is he a musculoskeletal physio, your dad?
Yeah, MSK plus he does community mainly though.
Right. Fantastic. Is that what you want to go into, or what area do you want to travel to?
I haven't really looked into it yet, but what is it? Sports side I really want to get into. I want to at least try one of those in my placements.
Yeah.
But it's very competitive though, so I'm not sure if that's
Yeah.
like easy to get into.
Yeah, I bet it's tough. Think about sports physio, sports rehabilitation is that there's a couple of different degrees that are interested in those types of jobs, isn't there? You've got sports rehabilitators as well as sports scientists all getting involved in that too. So yeah.
It's all about the context that you have. Like if you've got a mate who's a footballer, like he'll pretty much give you the job.
Or a dad who's a physio.
Yeah, definitely about connections for the sporting world, physio, isn't it?
Yeah, a little bit of nepotism going on. That's never hurt anyone. Good. And I know that most of you, because I talk a lot, most of you probably know what my story anyway, but I'm going to give it a go again. So my name's Damien. I'm a mature student, as you could probably tell. And I came to sport a bit later. So I'm interested in sport. That was my main intro into physiotherapy, but I came a bit later. I started running 7 years ago as a means to lose some weight after I gave up smoking. I gave up smoking from 20 years of smoking, and loved it so much that I've done multiple marathons, halves, 10Ks, 5Ks, all that kind of stuff. And when I was made redundant from a job that I absolutely loved and adored, I decided not to get out of the rat race and study again as a physio. And I chose King's because, if I'm completely honest, I chose King's because it was the most convenient for me to get to. It's one train all the way to London Bridge, and then I walk across the site. So it's that's me. So thanks for that, team. Okay, so what we're here to talk about is our debrief on placements, how things went for us, what we learned from it, I know that we're going to be doing this as part of our reflection anyway, as part of our assignment, our tasks. But I think it's really useful to kind of verbalize it for us, and then hopefully for everybody else who's listening as well. So if that's all right, Senorina, why don't you start? Why don't you tell us about your placement, where you were, first of all, and then we can then go into how it was for you.
All right. So my placement was in the respiratory physio team at King's College Hospital at Denmark Hill, where I was in intensive care for 5 weeks. To be honest, the first couple of weeks was kind of rough, but also interesting. Not only because we don't have the first week of training like you guys who did a week of simulated online training where you get to practice.
Oh yeah, that's right. Because your placement was before ours, wasn't it? So we had our placement basically finishing last week, but for 4 weeks, and you were immediately before that for 5 weeks.
Yeah.
Yeah.
Because the fact that we started immediately, and there's only like such a small cohort for us, we didn't have any prior training, especially with writing SOAP notes and all other stuff before we actually start. The first week was pretty much kind of we are a little lost, to be honest, because we don't know what to do. How should we do things? We didn't get much training. So we learned all that on our first 2 weeks of placement. So trying to get ourselves familiarized with the work environment, how to do stuff, and like just mainly observing and also trying to participate in little bits of the rehabilitation for patients. And as the weeks went by, we start to involve more. We try to involve more at the same time, trying to look for things we can improve on. And the last week I actually did a lot of like involvement in patient sessions and all that. So
sure.
Overall, it is intense for the first year to be working in intensive care, but I have to say it's really rewarding. And I definitely know that my choice of choosing physio as a subject in university isn't a decision I would regret.
Yeah.
Because I find it really interesting and I really enjoyed the process.
Wow.
That's pretty much it for me.
Brilliant. That's fantastic. So, I mean, intensive care for me sounds like a really scary environment.
Yeah.
So obviously you can't tell us about, because of GDPR reasons, but you can't tell us about any patient details. But what type of person or what type of condition were you looking after?
So for me, I work in a general intensive care unit in King's College Hospital, where we take all kinds of patients, like neuro patients, we have trauma patients, we have post-COVID patients. Generally, you take a bunch of everything. And unlike my other classmates who went into kind of specific wards for intensive care, mine was more of a generalized one, so we take all kinds of patients. Whereas for them, some of them went into liver intensive care units where they only take care of major liver patients. Some went into a neuro ICU, some of them into like brains, and they're more specific and directed into a specific group of patients. Whereas for me, I take a bit of everything. So it's quite a lot because every patient is different, as you know, and with different types of patients and their different conditions, you have to come up with different ways to help them in their sessions. And that's what I think is the hardest, because you have to adapt and apply the knowledge you learned in lectures and also as you learn in a placement into actual practical use. And this thing is the hardest. You have to integrate everything and use it whenever appropriate. But I feel like all of this is a really great learning experience and definitely helps me when I do my upcoming placement at the end of year 2.
Yeah. Amazing. That's great. So, I mean, again, the kind of details that you were going through. So, were you, how much time were you spending across the entire ward, or were you more with like individuals? Were you assigned an individual patient to look after at points?
All right, so here's how it actually works. So every day we have a handover where we have a specific list of patients in our ward and go over the conditions. I'm sure pretty much all of you guys know how that works in wards and general stuff. So then
I've never worked on a ward, so I'm not massively sure. My placement wasn't on a ward, so I could guess, but I don't really know.
All right, so to add a bit of information, in wards or intensive care units, we have a bunch of patients in every unit where the doctors will do a handover every morning with physios and other medical professionals at present. They'll go over the condition of every patient overnight and whether there are any specific changes. After that, the physio who attended the handover at the ward will go back to the office, relay it to their team of physios, go over every single patient, but we only transmit the information which are specific and important to us as physios when we do our treatments to the others, and then we'll pick up the patients we would like to treat individually. For example, the band 5 physios, they can choose like, oh, who they want to be treating today. And sometimes for us student physios, we have to do joints with our supervisors because we are not eligible to do that on our own, of course. So we choose our patients which we want to treat on that day, and we'll follow the list in terms of priority, and we go and treat those patients in order.
Yeah. Wow. So you do the priority list yourself as well? You are helping contribute to that?
Yeah, so the first 3 weeks was pretty much observing how they actually categorize patients into the order of priority in which they should be seen. And in the last 2 weeks, I did contribute more in terms of suggesting what priority the patients are and like who should we see first, like how urgent they are to be seen and all that stuff. If that makes sense. Yeah,
absolutely. Yeah, amazing. Thank you so much. That's it. That is really interesting. I say it seems to me like quite a scary place, ICU.
Absolutely.
But it sounds like you've had a good placement.
Yeah, indeed.
Cool. Thusha, where were you?
So for my placement, I was at Whipps Cross Hospital. That's like near Leytonstone area.
Yeah.
And I was with the medical team covering respiratory, gastro, and a couple of medical wards as well.
Okay, so you kind of moved about a little bit.
Yeah, moved about, but for me, I was just mainly in one ward. It's called Curie Ward, and there was about 15 or so patients that in that Bay Area, and it's pretty much like Signorina's, what she was saying. So we'd have the morning prioritization with the handover sheets, and we'd go through the list with all the patient data and do the P1s, P2s, and write down if it's assistance of 1, assistance of 2, and then we'd have a bunch of meetings with the MDT and pretty much just prioritize all the caseload and get it all set up ready for the day.
Yeah, amazing. So when you were actively at a patient's bedside, obviously, again, you can't tell us any personal information, but what kind of things were you doing?
So most patients were just mobility practice or like functional assessments. So what we'd do is, so if they're laying in bed, we'll try and get them sitting on the edge of the bed and assess if they're able to do that independently or if they require assistance, and obviously note all that down. And then we'll try and get them standing up and maybe even walking on a frame, or what else did we use? We used the SARA Steady. Do you guys know about that?
Yeah.
It's like a big frame thingy. It's pretty much easy to stand up with.
Right. Okay. So it's like a higher rollator.
Yeah, pretty much. And we just stand up on a little platform.
Okay.
And they just pull themselves up with it.
Right. And that's called a
SARA Steady.
SARA Steady.
SARA Steady, yeah. So it's just usually used by like frail patients who have had falls and stuff.
Yeah. And is that the type of patient that you had on your wards? Yeah,
so it was mainly elderly patients, like over 60s, I'd say, most of them, and what else? COPD patients, lots of shortness of breath. A bunch of them were on oxygen,
right,
and stuff like that, really.
Okay, wow, that's really good. What challenges? What kind of things were you challenged to on that while you were on your placement?
I'd say everything was pretty much a challenge, but as the weeks went on, like it became a bit repetitive with the tasks that I was doing.
Okay.
So the first few weeks I was mainly like observing my educator, but then by like mid-week 2 / early week 3, my educator went off on holiday.
Oh wow!
So, and we were pretty much really short of staff, so I ended up seeing patients by myself.
Yeah.
for like all of week 3 pretty much.
Yeah.
And yeah, that was pretty challenging because I was just in the deep end on my own. But there was
Yeah.
like all the OTs and a couple band fives were there to help me, like if I needed questions or anything like that.
Fantastic.
So it was a good learning experience though.
Yeah, I bet it was. That sounds crazy. Sophie, where were you?
I was at Charing's Cross Hospital, so I was on the neuro rehabilitation ward.
Mm.
And that was, I mean, the first few weeks were a very steep learning curve. It was very much like they would say some abbreviation or they would say something and I would straight away write it down and then go home and spend some time like looking up, figuring out, like decoding these abbreviations because it just got so much. And part of it came from the fact that so being on neuro, a lot of our patients are really complex. So
Yeah.
the way it works for Charing's Cross was you had HAZU, which is the hyperacute stroke unit. So that's like as soon as you have a stroke, like within the first few hours and days, you go there. Or if you're predicted to have a stroke, you go there. And then you go into the acute stroke ward, which is kind of like a few days after your stroke to like a month.
Mm.
And then you go on to the neuro rehab, which can have you for up to kind of 3 months average.
Wow.
So total stay, if you go from having a stroke to hyperacute to neuro rehab, you're kind of looking at 4 to 5 months being in hospital.
Wow.
So when the patients come to the ward that I was on, they've already kind of been in hospital for about a month, if that. And then we kind of have them for 12 weeks. So it's really, because 12 weeks is such a long extended time, you can see such progressions with patients. Although you kind of think to yourself, you're like, I'm seeing you every day of the week for every week of this month and then for 3 months. So it's quite intense because you kind of live their lives with them for part of the year. And you get to know them, they get to know you. You kind of experience this with them because a lot of my patients were stroke patients. So the 2 that I ended up doing solo work with were stroke patients, and it was such a I don't really know the word right now, but it's so you know when the penny just drops and you really realize what's kind of in front of you. It was one of those experiences because one of my patients had a stroke. He actually had loads of mini strokes and then one big stroke, and
TIA.
Loads of TIAs. And then he was left with his whole, I want to say left side of his body, like his left arm and his left leg completely working. And he was saying like before his strokes, he'd be running, he'd be doing all of this. And for someone who's quite athletic, I'm thinking that's literally kind of what I do. Like I imagine waking up one day or kind of like 3 weeks from now and not being able to use my half of my body. So it really hits you how impactful you can be to patients just by having simple like bedside manner and building a rapport with them. And I won't forget one of the things that one of the physios said, and she said that it's actually incredible how many students come on placement and actually can't talk to patients. Like part of your interview is like when you get into university, part of the process of doing whether it's your group task, your group interviews, or your MMIs is, some questions about bedside manner. And a lot of people can you can say the right thing, you know what they want to hear, so you can kind of say that. But then when push comes to shove and you're in front of a patient and you've got to talk to them, some people just freeze up, and it's like I don't know, I just can't quite imagine. But I think thankfully I didn't freeze up and I just got chatting, and I think I was probably nervous to not chat, but it was quite a challenge, to be honest.
Cool, that's amazing. So stroke patients rehabilitation, it probably is as it sounds. It's quite a physical part part of it is getting people up and getting people mobilized early on. But what kind of things were you doing?
Yeah, you're right. It was really quite physical. So when I first got there, one of my patients, when I was starting with my educator, it required one of us to be kind of assistants of one and kind of supervision of two. So it was very intense, and he would put all his weight in your hands and you'd be thinking, oh my gosh, this is a 70-kilo man putting all his weight in my hand. I think it's going to fall off. Thankfully it didn't, but we would kind of struggle to walk 10-15 meters, and a lot of strength training on the plinth, a lot of balance exercises once he was able to. And he was quite a great patient because he was very motivated. He also used to be in the army actually back in the day.
Wow.
He had a very he was very stubborn. He was like, you want to do 20? We're going to do 25. And it's like, go on, do it, I dare you. Obviously safely. And yeah, he was just great. And then by the end of it, he could do 2 laps of the ward. And we managed to go down to Costa because his walking had just improved. So
wow.
This is so cool.
I mean, that is
what you're here for.
That sounds super rewarding.
It was so good.
Yeah, that sounds like you've worked with him, and then at the end of it, he's you can see the improvements all the way along.
Yeah, and I think as well on the emotional side, he was just like, "What? So it's your last day on Friday?" And I was like, "Yeah, it is." And he goes, "Oh, what am I going to do without you?" I was thinking, "Keep walking." It's just kind of crazy because for me, I was seeing the same patients every day.
Yeah.
It was routine. You walk in, you say hi, have a quick chit chat, and you get on with your session. And it's just crazy how fond people become of you and how fond you become of others. And before you know it, you kind of got to move on with the next part of your summer, whatever's going on. But you can really make an impact if you want to, and I think that's the biggest lesson, really.
That's amazing. That's really amazing. That's really cool. Thank you. I'm not crying. You are.
Oh,
that's cool. I think that's really cool. That's I probably knew that up here, but I hadn't really thought it through before. That that it's going to be a really rewarding time, with those people, day in, day out.
Definitely experience the kind of for you to realise it.
Yeah. Okay. Thank you, Sophie. That was really cool. That was really, really good. Thank you. I'll tell you about mine now, if that's okay. So I was at Croydon University Hospital in the cardiac rehabilitation unit. So it's actually an outpatient unit, and they deal with everybody who's had mild angina attack. So as we all know, angina is a condition that affects your coronary arteries. Tightness of those arteries, you most likely to get pain across your chest, sometimes into your arm, all the way through to patients who had heart transplants. So the patients we were dealing with typically were men. Typically they were overweight and or had led healthy lifestyles, but none of them, not a single one, was what you would typically look at and think that person's going to have a heart attack. They were overweight, but there was none that were grade 2 obese, morbidly obese. And I think that the patients that we were seeing were essentially unhealthy lifestyles to some extent, but mainly bad genetics. And there's one guy in particular I remember. He was only a few years younger than me, so much older than all of you. But he had a valve replacement. So one of his valves, I think it was his mitral valve, if I remember rightly, had disease on it, and they replaced it with a mechanical valve. Because he's so young, the mechanical valves last longer, which means that he can have it replaced in 15-20 years time, whereas the pig valves, or the porcine valves, or the bovine valves, they tend to only last about 5 to 10 years. So because he's so young, there's no point doing that. He needs to have a mechanical one. But one of the side effects of the mechanical valves, which is really interesting, is that you can hear it. So I could hear his valve. I could hear his heart beating while I was sitting there doing a subjective assessment with him.
With a stethoscope, or was it just like with your hearing?
No, just normal hearing. Just normal hearing. I literally just sitting there, talking to him, and in between, breaths, in between pauses of me thinking of the next question, I could hear a little tick, 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 tick.
That's pretty cool.
Thinking, what's that noise? And I've got this thing going around in my mind, thinking, what is this noise? And I had this memory that some people, when they have their chest cracked and they do a sternotomy, which I watched I didn't watch an actual operation, but I watched a YouTube video of how they do it as part of my preparation. And some people, when they put them back together, they sometimes click. And I was thinking, is that a click from that? Is it a click of his sternotomy? But I was like, no, you had a valve transport. That's not how they do it. And then it wasn't at all. I figured it out that it was a mechanical valve. I could hear it. So, but then I went and took his pulse, as we were trained to do. I didn't really need to because I could hear his pulse. Very strange moment. So yeah, so what we were doing. So I was with Charlie McLean. Hey yeah. Charlie, how are you? And what we were doing, essentially exercise classes for people who'd had heart events. So we would see patients for initial assessments with either a nurse or with one of the physios. And then the last couple of weeks, we were running them by ourselves, Charlie and I. And then we would invite them to come to an exercise class. And then the people who came to the exercise class, they were coming every single week usually for 7 weeks. So we saw people who only a few times did we see people that we did our interviews with, who then came to their very first class or second class while we were there. But the majority of people had already been in the program, and we were seeing them week in, week out for those. And that was really nice to kind of, I mean, probably a lesser extent to what you had, Sophie, because it was only once a week, but it was still very rewarding to then work with the same people and see their progress as we go along. Yeah. And then the main objectives of the program was to improve a person's cardiovascular response, improve the person's fitness, and we had a functional capacity test that was done at the beginning of the program and at the end of the program to kind of test and objectively see how well they'd improved, and we did quite a few of those as well. So yeah, it was really interesting. I don't know if any of you saw the cardiac rehabilitation session in the Simpews week. Did you see that? Any of you?
Was that by Legs?
Say that again, Sophie.
Was that by Legs Charity?
Legs was in that one. Yeah, they had a session on a different day to this, but this was, I think this was Hambledon Hospital, and they ran it for us, and it was basically watching one of their exercise classes. And if I'm completely honest, watching an exercise class and not participating is a bit boring. But actually being in the room with the patients and seeing them do their exercises and joining in with them, and then when they go and do their warm up, and then when you go and do their circuit with them, which they would use weights for, and treadmills and exercise bikes and all this kind of stuff, and coaching them through it and trying to improve their technique a bit better and all this kind of stuff. It's kind of like both sides of the coin in the sense that it's sport orientated, but it's actually healthcare. So it's a really, really kind of really nice hybrid placement where you get to see loads of stuff like that. So I really, really enjoyed it. And I think it was probably the best 4 weeks of work I've had in my life. And I've done a lot of work over the years. Well,
that's quite a win for you, isn't it?
It's a win for me.
What sort of level do they come to you at? Like, how far are they from being out of hospital, for example? Like, for example, my patients were like 2 months, a month post-stroke. What were your patients? Yeah. What was their timeline?
Yeah, similar numbers. So they aren't able to come for initial assessment until they're 6 weeks post MI, so post myocardial infarction or post cardiac event is probably a better way to describe it, actually. Yeah. If it's a STEMI, so that's an ST elevated myocardial infarction. So that means the ST points on the ECG are elevated, so that's what they call a serious heart attack, then it would be 8 weeks. If it's a non-STEMI, so a minor heart attack, not that there is such a thing as a minor heart attack, is it? But you know what I mean. Then it would be 6 weeks, and then again, because there's obviously been COVID times, there were lots of patients coming through that hadn't been seen at all. They'd been spoken to by phone, they've been spoken to on Teams or video chat, but they haven't actually been seen by the nursing staff or the physio staff. So there was quite a lot of, and Charlie and I helped because we were obviously extra members of staff who could help, you know, push things along a little bit, and try and help clear that backlog a little bit, which was great. And I just want to make and each of you can do this as well if you like. I just want to have a shout out to my practice educator, Nikki, who was absolutely amazing. I mean, I know that most band 7s or band 6s even who are looking after us have got years of experience and are brilliant at what they do. But I think Nikki was phenomenally good. She actually used to be a nurse, and then she changed to physiotherapy. So she's got a wealth of knowledge and a wealth of experience.
Yes.
And she was brilliant at training and developing us as well. She even taught us how to do manual blood pressure. So the old machines where they use a stethoscope on the arm and all this kind of stuff. So I'm well versed on that as well.
Good. Yeah, no, shout out to mine too. She was a vault of knowledge. I don't think she'll watch this. I don't think I mentioned it.
No.
But she was incredible.
Good.
Shout out to my 2 educators, Emma and Florence. They're pretty good. Taught me everything I know.
Fantastic.
Same for me. I'd like to thank my educators, Becky and Grace. They are the 2 major physios who were looking after me for the past 5 weeks. I know, like, I'm not the best student, and I definitely had a lot of bumps throughout learning, but then they're always so patient, and they always taught me everything and give me lots of advice on how to improve as a person and as a physio. So thanks to them both. A small shout out for them too.
That's good. That's an interesting point you say there, Serena, because I realised how much I'd forgotten about the heart anatomy lessons we did when I arrived at the unit, and they were talking about LADs and circumflexes and left obtuse marginal and all this stuff. And I was thinking, I know these, but I can't remember where they are. So I then had to spend the first week. I filled in my hours. I did so many hours on that first week because I was just every night I was coming back and just studying and looking through my anatomy books and all this kind of stuff. So it's very useful.
Can relate to that first week of there being so much you don't know what was said. Like you kind of think of it and I got to the end of the second day and I literally thought the only words I understood was see you after lunch. And everything else was just like, what? So a lot of looking up, a lot of research, and I think everyone can relate to that.
Yeah. And actually, I mean, I'm gonna steal that from you, Sophie, and I'm just gonna say the next part of what we're gonna do is tips for people who are going on to placement soon, whether that be your second placement coming up or whether that be your first year and you've got a placement at some point in your first year. And I think that for me, the tip that I'm going to steal from Sophie is make sure you write everything down, because ultimately, you're not gonna retain that information because there's so much of it. It's just gonna drip out of your ear. You need to write it down. Write down the abbreviations. Write down the procedures. Write down the if you're on ICU, maybe write down the normal ranges of observations, so that you know what's not normal. All that kind of stuff. Because it's very vital. Now I've stolen yours, Sophie. I'm going to come to you and ask you what's your second one.
My second golden nugget of the podcast.
Yeah.
Is this just general placement or just general physio?
Yeah. General placement.
Okay. My my placement golden nugget would be, well, my second one actually would be to invest time in the colleagues that you'll be surrounding yourself with, because they are the people that are going to make your experience much better, and equally they can make your experience not so pleasant. So put your time into making friends with them, getting to know them. You might only be there for 4 or 5 weeks, but this is 4 or 5 weeks of your professional development, and at the end of the day it's people skills, and we need them for whatever we want to do. So just, you know, be good at chit chat, and if you're not, get better at it, because
Get better at it.
So I think that's my thing.
That is a good tip. If you're not good at chit chat, get better at it.
You can tell I come from a family of 5 kids, can't you?
Oh, me too. I'm one of 5 as well.
Oh yeah, yeah.
Cool. Oh, we talked about this before, didn't we? Yeah. Okay.
Yeah, we have. Yeah.
Senorina, what tip have you got?
So I've got a few. I'll try to go through them quickly. The first one is that for placements generally, it's kind of tied to like all the things you learned throughout the semester. And in lectures, when you learned all that theories and all those stuff, at first it doesn't make sense, and it's all right, because when you go on actual placements and you have to make use of what you learned in lectures and all the knowledge, everything will start to come together, and it will make a lot more sense when you actually start to think about all those values, all those ranges, what is normal, what is abnormal. Everything will start to come together. And at first, for me, I was like, so why do I have to memorize that? Like, what's the point? But then as I do my placement and I have to look through a lot of charts, a lot of data, especially from like all the lab stuff, it starts to come together. And then I just realized, oh, that is important. And that's why I need to know these, because these is correlated. For example, like, why do we need to know the normal values for sodium and potassium levels in patients? Because they are linked to contractility of muscles. And if they are out of range, it might affect how the heart muscles work. And in turn, if it is out of range, meaning their heart muscles are working abnormally, this might lead to having higher risk of having, for example, heart attack and other correlated side effects that come along with it. So this is very vital. So my first tip would be try to revise a bit of the knowledge related to the parts or the specialty of the physio you're going to do your placement in, because it will come in handy when you actually start working. The second tip is do constant reflection on every patient session you do, and think about what you can do to improve as a physio, because reflection is very important for us as healthcare professionals, because we're not perfect. I have to be honest. Like, we make mistakes. Even I make a lot of mistakes in my placement. But then every session, as the weeks went by, I try to think about like what went well during that patient session, what went wrong, what could I have done to do better next time if I had similar situations like these. And all in all, I just built up this constant habit of reflecting. And my educators also remind me the reason why reflection is so important for us, because it helps to develop us as a physio and also as a character, because we always have to know like what we have to work on, and it helps us grow as a professional. So these are my 2 main tips.
Amazing. So good. Well done. That's they're really good tips. Yeah. I'm going to tell a story in a minute, but first I'm going to come to Thusha. What tips have you got for a placement?
So golden tips, I would say, for year ones, just don't be anxious going into placement. Like, especially me, like when I was going into it, I was so anxious because I never worked in a hospital. I've never really been in a hospital, and like, especially like I was on my own. I didn't have anyone else working with me. So I was just on my own as a student in my very first placement. So so just don't be nervous going into it. Be relaxed and just be you. I think that's the most important thing, because if you're nervous, you'll be anxious in front of the patients with your colleagues and all that, and that won't be good for patient care or with like communication or anything like that.
Yeah.
So that's one of the very good important tip. Another thing would be A4 little notebook, or no, A3 little notebook to just write down stuff.
It's A5.
A5.
A3 is massive.
A3. No, sorry.
A5.
A5. So little A5 notebook and coloured pen, just to note down little stuff.
Yeah, that's right. Brilliant. So good. So let me tell you a quick story. This is my tip. My actual tip, not the one I stole from Sophie. Is the feedback I got from my placement was I need to consider much more the patient and patient safety rather than getting the job done. I'm paraphrasing, but essentially that was it. Because patient safety is paramount, which I know, you know, we all know. If patients aren't safe, then it's not just a question of us passing or failing. It's a question of us, not doing a good job for that person and potentially hurting that person, which is obviously what none of us want to do. I was doing an initial interview with a man who had very, very high blood pressure. He peaked. I took it 3 or 4 times, but he peaked at 190 over 89. I think it was 190 over 89. And I noted it. I noticed it was high, and I circled it, and I made a note on his records that it was on his paper notes that it was high. But then I proceeded to try and exercise him on that blood pressure, and it wasn't exactly. So what happens when you exercise anyway? If you and I exercise, your blood pressure goes up. So what happens if you exercise on massively high blood pressure? Your blood pressure goes up, and you're at risk of immediately having a stroke and or a second heart event. And there's me trying to get him to do shuttles up and down the chin. Oh, it's not funny, really, is it? But anyway, so I needed to consider that and realise that actually, I knew all of the information. I knew what the contraindications were. I knew about patient safety, but I didn't actually piece it all together and put it into practice. So that would be my other tip: would be learn the contraindications, and if you're like me, learn why you need to do them. Don't just learn them as in, I mustn't do this, mustn't do that, mustn't do this, but actually learn why you mustn't do that so that you don't ever do it, if that makes sense.
I think that's a really good advice, just being able to link different topics that we've learned together.
Yeah. And Senorina, you're absolutely right. All the information we've learned over the last year, and it is a little dry. All of that information is a little dry. I mean, no disrespect to him, he's good at what he does, but the anatomy lessons are tricky. They're hard, aren't they? There's a lot of information to get through. It's a bit dry, but I now know all of the stuff I've learnt, thanks to Alistair, is in there, and I now know how to apply it to a patient and understanding what procedure they've had when it comes to their heart, because I link the two things together. And Senorina is right. It will come. It will start to make much more sense when you go out on placement. So
for sure, yeah.
Good. Just before we go, has anybody got any other tips or anything else that they'd like to say to maybe people who are listening to the podcast for the very first time, potentially even year ones who haven't quite started yet?
I'd say bring water, like a massive water bottle.
Yeah.
The amount of talking that you do with patients and like with peers and everything, you definitely go for a bunch of litres.
That's 100%. And I learnt on my placement. So my placement, I call them serial snackers. They are formidable. They are amazing at snacking. It's quite literally walk in the morning, get your coffee, get a snack, get a biscuit just before you read notes, just read notes, get a snack, about to go see a patient, come back from a patient, get a snack. It was quite literally, very rhythmic in terms of snacking. And I'm not really one for snacking. I'm more like kind of just get to the, like when you usually eat. But I did find that when you're on your feet all day, it makes such a difference having a snack just to pick me up. So definitely consider something.
If you don't usually snack, start investing in snacking.
Yeah, I mean, that's definitely one way to look at it, isn't it?
So just before I come to you, Sunu, if you've got one, you don't have to. And Nadia's interview, which she did after her placement,
Yeah.
which we did back in the end of July, her tips, if I remember rightly, were just listen to your practice educator, listen to your band fives because they're closest to you in actual reality, and eat the cake. So,
Yeah.
and obviously we've got Sophie's tip is now snacking, and Sasha's tip is drink water. So, so Narina, have you got a tip for general physio or for maybe potentially year ones?
Yeah, sure. So my general tips for year one students who are coming to study physio or healthcare in general. I know it's intense. We all do. Trust us. We all experience the intensity, especially for me. I have a lot to catch up on because I know like some of you guys take like access courses, and some of you even have like prior degrees in like sports therapy or orthopedics or whatever that is, and you already have a solid foundation. So learning the stuff, the anatomy stuff especially, would be easier for you guys. But for me, I'm someone who absorbs knowledge very slowly, and it takes a long while for me to actually understand the concepts. So every I have to spend a lot of time to go through the materials, reread them, try to understand them, not just to memorize. Because when it comes to uni, it's very different from high school. You can't just base solely on memorization. You have to actually understand through and through, not just, oh, okay, so this one is this one is that. You actually have to understand and know how to like integrate all the knowledge you've learned into actual practice when placement comes in hand.
Yeah.
Because the problem is, if you just rely on memorization, okay, you pass through your theory exams, you pass through your practical exams, but when it comes to actual placements, you're at a loss. Like, okay, I know I need to do this, but when your educators ask you, oh, so okay, so why do you have to do this? They're like, yeah, that happens. So I think a tip, try to actually understand. If you don't, your course mates are always there to help you. We just try to host more study sessions with the others. They'll help you understand the concepts, and also everyone has different strengths. So maybe you're weak in this aspect, but then your course mates may be able to help you. So don't be afraid to ask for help. And another tip would be try to catch up with the workload every week. Just do your best. Try to start early. I always start on the weekends before to try to get a head start on the anatomy stuff, especially because there's so many lectures every week. It gets so intense that sometimes I struggle to catch up. So I usually start early. So I start watching the lectures, rewatching them, writing my notes. So when the actual week comes, I have less work to do. And even if the content heavy on other modules, then I still have time for those.
Yeah.
And I stack up the workload week after week. And in the end, I may have like a ton of lectures to catch up on. And that actually helps, because what if you procrastinate every week and you don't get your stuff done? And the worst scenario is that when it comes to actual exams, you have a tough time catching up on everything you need to learn. And trust me, that's not going to end well.
No, exactly. Brilliant.
Can I just piggyback on that point, actually?
Yeah, go for it.
That actually it's more controversial, but Senrina, you might not like me for this, but actually I was gonna say kind of chill out a bit. Like, I think the first year, I found the first 3 weeks I was living in halls. So I was like, oh my god, this whole new life, I gotta get used to it. It's quite overwhelming. And then uni started, and you kind of got to just the whole experience of going to university is quite a whirlwind of changes, because everything changes at once.
Yeah.
Especially if you're living away from home for the first time or living in a new country, it's a lot different, and you've got to find your own rhythm to you being on your own. But I would say to just chill out. I mean, it's just such like you lose nothing by relaxing and getting to know people, but you have everything to gain from it. So go to the socials, reach out, organize something, just chuck something out there on the physio group chat or any group chat that you've got going. Reach out to twos and your year threes, because they'll give you something valuable. And actually for them, for year twos and year threes, having some connection to year ones would also be good, because I know a lot of courses benefit from all the years being interlinked. And quite literally, that is how medicine survive. I've got a couple of mates that do medicine, and they say that is how they get through it, just talking to
being sociable.
Yeah, I mean, let's be real, you're here on a course that's about interacting with others, and like, just have a laugh, make the most of it. And if say what, like you don't do so well in a test or you don't understand something just yet, just kind of chill out and talk to someone about it, and before you know it, you understand the filament theory. And
I've said this a couple of times while I've been doing these podcasts. I'm going to say it again because it's a good point. That's the thing I think that we missed out on as a cohort, because we were only in the in university once a week. So the thing that we missed out on was the kind of coming out of a lecture and just chatting about that lecture and what we felt, what we thought about it, and what we understood about it, and all this kind of stuff as we were going to get coffee. Because we only saw each other once a week, our little bubbles, we basically all were always catching up with each other on how work was, or how we're getting on with with our life, or all this kind of stuff, and never really catching up about the lectures or anything like that. And I think that's where it's going to be different for us in year 2, because we're going to be in a lot more, and hopefully for everybody in year 1 who's starting at the end of September, hopefully they'll be the same, that they'll be able to catch up with each other a lot more regularly. Therefore they'll be talking about the important stuff, like the things they don't understand, as well as chilling out and going to socials. And I love what you said there about get on the group chat and organize something. I love organizing things, so I don't mind organizing a social, or trying to organize a run for people to go on, or trying to organize people to come onto a podcast. I love it. It's great. So yeah, I'd encourage you to do that as well.
Yeah, I'll join you for the socials. Maybe not the run. I think I've done my quota of exercise for the summer.
You have done. If you want to know what Sophie's exercise has done for the summer, you should ask her. So thank you very much, everybody. We're going to wrap it up. Thank you very much for coming on. It's been a pleasure to have you. And our next podcast is going to be with Damien, the new president of the Physio Society. So please tune in for that one, which should be out before the end of September. So I'm going to do 2 in September because we missed out on 1 in August, and then I'm going to go to monthly podcasts after that. So everybody, thank you very much for your time. Good to see you.
Thank you for having us on.
Thank you for having us.
Thank you.
My pleasure. Wow. So that was a really, really interesting discussion, really interesting session. We all had slightly different experiences. So I love the fact that Sophie was talking about the rewarding effort, about how she's working with patients every single day, and she's seeing the progress that they're making, and she's really enjoying the fact that she can see their rehabilitation, see their journey, and it was quite, I don't know about anybody else, maybe I'm a bit too emotional, but it's quite interesting and emotional to kind of that man said to her, I don't know what I'm going to do without you. It's kind of, you make a big impact in people's lives doing this placement. So that's fantastic and brilliant. And then Senorina talking about how she felt slightly overwhelmed, and she spent quite a few weeks working, but then she started to feel comfortable towards the end, and it was for her, it sounded, my impression is anyway, I don't want to put words in her mouth, but it sounded more like it was a much more steeper learning curve, and she had to really work at it, which is part and parcel of a placement, I guess, like ICU. And then Tusha said he had a varying role where he was seeing different people in different places, and working with the teams and multidisciplinary team he mentioned. So absolutely brilliant. Sounds really rewarding what everybody went through. I know from my own placement that when we were rehabilitating individuals and we were seeing them on a weekly basis, that it was still rewarding. And one thing I didn't mention on the call, which I just wanted I've just been reminded of afterwards, was the fact that Charlie and I, hi again Charlie, we got to work with a couple of individuals who weren't suitable for exercise classes because of other issues. So one guy particularly we worked with had a stroke. Another guy we worked with had peripheral vascular disease, PVD, and it wasn't appropriate for them to come to class because they were at a level where they wouldn't be able to keep up with the class, and or the class would be working at a level outside of their capabilities. So we would work with them on a one-to-one basis, and that was very rewarding as well, and we did enjoy that too. So that was great. And then there were other patients that we exercised that were more at risk for COVID or issues, or were more self-conscious of that, and they didn't want to come to classes, and that was absolutely their choice, whether they wanted to come to class or not. And we did the exercise class for them online, and again that was much more intense because there was 2 classes a week for 4 weeks rather than classes every day. Classes every week for 7 weeks. So that was an intense. That was a very, again, quite a rewarding way of doing things too. So not that we get much of a choice, but if you do get a choice to go to a cardiac rehabilitation unit somewhere, I'd highly encourage it because it is excellent. As I mentioned in my in the call, the next interview is going to be with Adam, with Damien, who's the new president of the Physio Society. Look forward to talking to him, and I hope that you'll join me.